Many people suffer from back, muscle, or joint pain and have already tried everything: exercise, heat, nutrition. Our Liebscher and Pract exercises do show results, but the effect seems to be somewhat limited because the discomfort keeps coming back. Often, there's something completely different behind it that hardly anyone pays attention to, namely a deficiency in vitamin D3. As a doctor, I keep seeing that this exact deficiency can actually intensify different kinds of pain. In this video, I'll explain to you how it's all connected and what you can do to bring your body back into balance. I'll explain to you in detail now why a low vitamin D level can make your pain even worse. And that's on several levels that all work together. Why does a vitamin D deficiency increase the basic tension of your muscles? In my opinion, that's one of the most important mechanisms of all. That's the point that almost no one else can explain to you, but it's crucial for most people affected. When vitamin D is lacking, the calcium handling in your muscles changes. The muscle can't relax as well, and the tone increases. That means your entire muscle and fascia system becomes interconnected. Higher baseline tension. That's exactly the starting point in our Liebscher Pracht model. Too much tension, bottlenecks in the joints, pressure on cartilage, tendon and nerve pain. This happens throughout the whole body. In the knee, there is increased pressure on the joint surfaces in the hip. Additionally, there is greater tension on the capsule in the back and increased tensile stress on the discs and the vertebral joints in the neck and head area. Tension headaches develop easily. That means vitamin D deficiency makes the muscles less flexible, functionally shortens them, and as a result, the joint ends up hurting. Many people experience this as diffuse shifting pain throughout the body or as symptoms similar to fibromyalgia. This mechanism explained above is enough to massively intensify pain. By the way, vitamin D also regulates pain perception in the nervous system. That's another level that comes into play. In the brain and spinal cord, vitamin D receptors are located exactly where pain is processed. When vitamin D is lacking, the following happens. The nerve cells fire more quickly and the pain threshold decreases. Stimuli are perceived more intensely. Even harmless movements suddenly hurt. Studies have shown this as well. 95% of 276 chronic pain patients had a vitamin D deficiency. After supplementation, pain improved in 83%. I have seen exactly this in practice over and over again. Vitamin D is also one of the strongest, most natural anti-inflammatory agents there is. Many chronic pains are actually silent inflammation, a quiet, subtle inflammation that adds to the mechanical shortening of the muscles and fascia. Vitamin D reduces inflammation promotion, and also their substrates, which are produced in this context, such as interleukin-6, tumor necrosis factor, alpha, and so on. If vitamin D is lacking, this inflammation just keeps smoldering permanently and intensifies every sensation of pain. It's like an amplifier that's always on, but vitamin D also protects muscle cells and fascia cells. A lack of vitamin D in the muscle causes more pain because vitamin D ensures that muscles have energy, can work properly, and can regenerate. If it's lacking, the muscle gets tired more quickly at certain points in the body. They hurt more often, fascia sticks together more easily, and that typical feeling develops. The whole body hurts. This is especially clear in the case of fibromyalgia. Here, vitamin D supplements are often especially effective and impressive. There is a double-blind study on this that has shown with vitamin D supplements there is less pain, better muscle function, and less stiffness, just by simply bringing the vitamin D level back to normal. Do you actually know how vitamin D and pain are connected? And if you do, write it in the comments. What does vitamin D have to do with mood, sleep, and pain? Vitamin D is right at the center. Vitamin D acts in the hippocampus, in the limbic system, exactly where mood, stress, and pain are interconnected. So what does a deficiency do? A deficiency leads to a low mood, quick exhaustion, sleep disturbances, increased susceptibility to stress, and all of that, of course, significantly intensifies the pain. Body and mind are directly connected here. That's why pain patients should always have their vitamin D levels tested. You can do this best at your doctor's office, but also in many pharmacies or with a test kit from home. The target values should be at least 50 nanograms per milliliter. For optimal results, I recommend at least 60 nanograms per milliliter. Even a little higher is absolutely fine. Anything below that is not sufficient for pain patients, in my opinion. A meta-analysis with over 3,600 people has shown this. Vitamin D is especially effective when there is actually a deficiency, so when you are undersupplied. That is present when it's less than 30 nanograms per milliliter. This exact range is often found in cases of chronic pain and pain conditions. And now let's talk about how you can replenish your vitamin D levels. There's a rule. First measure, then replenish, and then maintain the optimal level. My recommendation is always 3,000 to 5,000 international units per day. Of course, it also depends a bit on weight, but always combined with K2 so that calcium is distributed correctly. And please never just take it based on your gut feeling. Always check your levels. So, my short, clear conclusion. Vitamin D deficiency increases the basic tension in your muscles. This tension is also increased by our limited movement, and the trained increases in tension, which intensifies the bottlenecks. That's exactly where even more pain develops as a result. In addition, vitamin D deficiency also increases pain sensitivity, promotes inflammation, and weakens the muscles. It affects your mood and also your sleep. Vitamin D is one of the most overlooked but crucial factors in chronic pain, and it's one of the easiest ones you can correct. If you know people who are in pain and just can't seem to get out of it, please send them this video.